Greetings from National Academy of Medical Sciences, India. NAMS has been recognized by the Government of India as a nodal agency for promoting the continuing medical education for medical and biomedical professionals. National Academy of Medical Sciences encourages and sponsors nationwide CME programs, symposia and workshops in medical and biomedical professionals. NAMS is pleased to announce the launching of a joint NAIIMS NAMS Navigate CME program from 1st September 2023 for postgraduate students in all the NAIIMS and other eminent institutes of national importance from Andhra Pradesh, Arunachal Pradesh, Assam, Bihar, Chhattisgarh, Goa, Gujarat, Haryana, Himachal Pradesh, Jammu and Kashmir, Jharkhand, Karnataka, Kerala, Madhya Pradesh, Maharashtra, Manipur, Meghalaya, Mizoram, Nagaland, Odisha, Punjab, Rajasthan, Sikkim, Tamil Nadu, Telangana, Tripura, Uttar Pradesh and Uttarakhand of the country. The program is being conducted online on the first Friday of every month from 3 p.m. to 5 p.m. The NAIIMS NAMS CME focuses on the topics which are of common interest for the postgraduates across all specialties. The aim of the National Virtual Postgraduate Medical CME is to help them to be more proficient in their profession. Each session will cover 2 topics. Each topic will be of 1 hour duration, which includes 45 minutes for presentation by speaker, 15 minutes for questions and answers. Thank you for your kind support.
Hello and good afternoon, everyone. So welcome to the next AIIMS NAMS Navigate Medical CME program. Since we all are learning new topics, this time, if we see in our society, in various reasons, it doesn't matter whether it is rural area or urban area, but there are various factors which we might not be aware. But today, with us, we have an eminent speaker, Professor O.P. Kharbanda sir. So he will be with us, guiding us regarding global burden of oral diseases and the need of oral health and its treatment. So, without wasting much time, now I would like to request Professor Umesh Kapil sir, the Secretary of National Academy of Medical Sciences, for the welcome address. Over to you, sir.
Thank you very much, Dr. Jaswant. Grateful to you for a nice introduction. First of all, my most sincere welcome to all the participants who have joined online. We are grateful to you. We are also thankful to Dr. Kharbanda, who is one of the most eminent dental scientists in the country. And honestly speaking, we talk about oral health. It's a very, very important area. We might have dentists in different parts of the urban areas. But if you look at in the rural areas, MBBS doctor is a dentist. He also does everything, because going from a 70, 80 kilometer to a district place or district headquarters for a dental consultation is a very demanding thing. Now, this Navigate program which we started was essentially to update the knowledge of the postgraduates and the faculty members in all specialties of the medical sciences. It is not essentially for the dentist or faculty or the postgraduates of the dentistry. It's for everyone. Now, there are so many things which are happening in the field of advances which are happening in the field of dental sciences. A colleague of mine who is practicing dentist, he says, Doctor साहब, अगर आपके किसी दांत के अंदर या गम के अंदर एक silent infection है, that is one of the important reason for a poor bypass surgery. because that's a source of infection for all time to come. Similarly, there are many other issues which are coming up. Dr. Kharbanda will be talking about oral microbiome and its relationship with so many other diseases, diabetes, pancreatitis, and so on and so forth. So I personally feel that there is a lot of research ongoing in the field of dental sciences, and they're trying to establish the biological pathway through which these diseases are influenced or impacted because of poor dental care and so on and so forth. Although dental sciences is a very big area which is coming up, and with now orthodontics coming up, there are about 6 super specialties which have come up, and each of these specialties are very important. And what we thought of at National Academy of Medical Sciences to have a series of lectures on dental sciences. We'll not get Dr. O.P. Kharbanda day in, day out. It's a rare opportunity for all of us to have his session. He's being invited to all over the world for different aspects of dental sciences. And we are grateful to you, Dr. Kharbanda, for being with us. And I'm sure that all the participants would be benefited by his presentation. My last request is, please do ask as many questions as possible, because this is a golden opportunity to clarify your doubts. I remember my days that we used to think, मैं क्वेश्चन पूछूं कि नहीं पूछूं, बट जो दूसरा पूछता था वो अब मुझको अभी भी याद है कि किस तरीके का क्वेश्चन पूछा, क्या जवाब आया. So this is good. Well, with these words, thank you very much, and grateful to you for your joining us. Over to you, Dr. Jaswant.
Thank you very much, sir. So next, thank you for such a nice introduction, and I would say the laying out the importance of oral health. So now I request the IT team head, Mr. Raviji, for the message from President, National Academy of Medical Sciences, Dr. Digambar Behra.
My dear young colleagues, faculty, and officials of the National Academy of Medical Sciences, a very good afternoon to all of you. With immense pleasure, I invite you all to this program. National Academy of Medical Sciences, that is NAMS India, it was established on the 21st April of 1961 with the objectives of promoting the growth of medical sciences. It was inaugurated at New Delhi on 19th December 1961 by Pandit Jawaharlal Nehru, the first Prime Minister of India. The NAMS fosters and utilizes the academic excellence of health professionals in the country as its resource to promote excellence in medical education and skill development in the field of medicine and allied sciences. The Government of India has recognized the Academy as a nodal agency for promoting continuing medical education for medical and allied health professionals, and is advising the Government of India on several matters of national health policy and planning. The best in the field of medicine are part of this umbrella organization, and who is who of medical science guide the NAMS. The National Academy of Medical Sciences encourages and sponsors nationwide CME programs, symposia, and workshops in basic sciences and applied clinical disciplines. The aim of the National Virtual Postgraduate Medical CME is to facilitate the postgraduate students and young faculty members to increase their knowledge in the medical subjects, to navigate them to be more proficient in their profession and pass their NEET and PG examination to become better doctors, eminent biomedical scientists, teachers, and researchers. As a part of this responsibility, NAMS, in collaboration with the AIIMS New Delhi and 16 other AIIMS-like institutions of the country, has initiated this navigation program in the form of dialectical lectures and discussions. The program is regularly held every first Friday of the month at 3 p.m. The best and useful topics are carefully chosen, and the best teachers from various AIIMS are picked up to prepare and give these lectures. I am sure you all will enjoy these talks and will like them and found them useful in your future lives. Thank you.
Thank you for the message. Now I request for a message and guidance from Director of All India Institute of Medical Sciences, Professor M. Srinivas. Thank you.
Namaskar. At the outset, I congratulate the team behind the NAMS-AIIMS Navigate CME program. Providing quality of education to our postgraduate students is one of the prime responsibilities of AIIMS. I know that our able faculty is leaving no stone unturned in achieving this mission. However, there always remains a scope for improvement. Through this unique initiative, there is an opportunity for our postgraduate students to learn from the experts in their field. This learning will go beyond the boundaries of department where our postgraduate students are working and will also bring in more flavor in their knowledge and at the same time ensure dissemination of uniform, high quality content all across the nation. Postgraduate students also form our primary workforce for providing patient care. This indeed is an important component of their training. We are aware that our postgraduate students devote a large component of their time for the patient care services and thus they have less time for self-study by the end of the day. The timing of this activity is therefore very carefully chosen. The sessions will be held late in the afternoon so that the beneficiaries do not have to make any extra effort for attending them. This by itself exudes the philosophy of a true teacher, a mentor that will handhold the children through the process of their active learning. As the sessions are online, which by its very design is a non-synchronous platform, it may seem that the delivery of the content will be one-sided, but enough measures have been planned and they are in place to make the activity as interactive as possible. The topic of the session will be shared with the students well in advance. This will allow them enough time to explore the subject and be better prepared to absorb the content. This design, therefore, also matches the concept and principles of adult learning. The program not only will help our postgraduate students in being better prepared for their examinations, but also will equip them with sufficient knowledge, understanding, and approach to be a better professional in their field. I wish this program all success. Thank you.
Thank you for the messages. So now it's turn to introduce the speaker for the day. In reality, I would say that I have been the student when sir was the chief of CDER and chief of CMET. So, like any length of introduction would be short enough to introduce him. Sir is already a very well-known figure. Currently serving as director of orthodontics and cleft care center. Sir has been professor emeritus and council member at NAMS, and also he has been chief of Center for Dental Education and Research at AIIMS Delhi, and founder chief of National Referral and Research Dental Institute, and also chief of CMET, as I just mentioned. He has been former pro vice chancellor at Ramaiah University of Applied Sciences, Bengaluru, and he has been awarded prestigious uh, award including awards from Dr. APJ Abdul Kalam Academy for in Innovation and Lifetime Achievement Award in Oral Health Policy and Advocacy. Sir has been author of multiple books, multiple publications, and sir has been awarded numerous prestigious awards, maybe national or international. So I'm just making it short so that we can listen to him more. Since this is New Year's first session and first presentation, again, I would request you to follow Umesh Kapil sir's advice that this is the opportunity that none of the participants should leave to ask as many as queries, as many as doubts. So I request all the participants to utilize this opportunity to learn from sir, and without wasting much time, over to you, sir.
Thank you very much. Should I share? थोड़ा ये मेरा स्क्रीन ठीक कर सकते हो? I don't want ये नहीं चाहिए मुझे. हो गया? That is okay. First of all, I like to wish a very happy new year to all the participants who have joined today. Also, I like to express my most sincere gratitude to the President and Secretary of National Academy of Medical Sciences for having considered the topic of oral health and dental diseases as a new series for the first time. And I would think this only shows their vision and also desire to share to the residents, postgraduates, and students all aspects of healthcare where the oral health is one of the most neglected one. I will share with you a lot of experiences from my background. I worked with AIIMS for long years, still working with ICMR, had an opportunity to work with WHO, Cochrane Oral Health, and also with charity organizations like ABMSS, because I have a special interest in cleft care. The topic which we have chosen today is only an introductory topic which will lead to a series of lectures in different aspects of healthcare, such as how periodontal disease would affect glycemic control and what is the relationship in that, how to prevent dental caries, which is rising very alarmingly, particularly in newborns, in children with a young age, the cleft lip and cleft palate in newborns, how to reduce edentulism because the restoration of artificial denture is too expensive, and so on and so forth. So today I will give you what is happening around the world and how oral health has emerged as one of the most important aspects of healthcare in last few years, and how WHO, United Nations, and other agencies and Government of India have together created a new strategies in terms of to reduce the burden, economic burden of the care. So there are two types of burden. There is a burden which costs a lot, and which also has a burden which in terms of lost man hours, and also pain and suffering. So my outline would be, I will talk about oral diseases, prevention and management, technology and subspecialties of dentistry. It's an introductory, and then each specialty would have its own expanded lecture. I wanted to include some introduction on research, how we can make India as Atmanirbhar in oral health related technology and similar things. I am sharing you this video. Please listen to it carefully. आवाज आ रही है?
Yes, sir.
To its designated place around the red planet. The success of India's Mars orbiter mission brings India into an elite club of Martian
yes.
explorers that includes US, the European Space Agency and Russia. And the Indian Prime Minister Narendra Modi has been watching this historic event at the ISRO headquarters in the southern city.
So India has done a lot of progress in space. We are the fourth country to have tested shooting a satellite in the space, and we are, I think, the first one to have reached the moon from an pole where nobody has reached before. And what is most important is that we have done it successfully at a cost which is much less than any cost other parts of the world, the developed country, where they have been able to do so. But now, if we look back at oral health, on the one hand, we have a most advanced technology, we could do wonders, but in terms of oral health, we have not done much. And according to the Global Burden of Disease ranking in 99 and now 2019, the oral disorders have remained on the top rank as far as GBD is concerned. If you look at the tuberculosis, it has come down from level 3 to level 4, and many more shifts, if you keep going down, have happened. For example, the vitamin A deficiency is almost gone. We have vitamin A deficiency is on 19th rank. So we could do a lot in many diseases, but very little in terms of oral health. And as the tweet by Benoit Verin, who looks after the oral health in World Health Organization, and he has been a big force in pushing the agenda of oral health at a global level. He has shown a very significant concern with this global trend. Now, how this world works in terms of overall collective growth of irrespective of the countries, we talk about United Nations and Sustainable Development Goals. There are many, which includes removal of the poverty, food, and health, first three. And among health, the oral health was never listed actually, because in health, we create a minimum indicators of universal health coverage, which each country should be able to look after their people. The non-communicable diseases fall in category 3 out of 16 services, and oral health is now being considered as a part of non-communicable diseases as a component of USC. I will take you to this historical picture, which was the 18th session of Executive Board at WHO headquarters, where Director General proposed that oral health should be important and should be considered as a part of the USCs. And it went over to the 2021 resolution, and we have a report which talks about Global Oral Health Status Report. And this Global Oral Health Status Report talks about objectives of oral health by 2030. तो ऐसा कहते हैं कि 2030 में मुंह में कम से कम 20 दांत होने चाहिए. This is what I think. This is what I have created, a message for the common man, because we lose teeth. And once the teeth are lost, it is not possible to repair them, because the dental tissues do not have the power to regenerate. Although a lot of work is going on around the world to regenerate the tooth again, and you must have seen so many news about it. However, it is yet to reach any stage of clinical success. So with this 74th World Health Assembly meeting, where they adopted this report, we talk that yes, oral diseases which continue to affect mankind globally in terms of numbers, they remain number one in rank among all diseases. And what is important here? This is irrespective of the classification of countries by the United Nations. It is globally high. It is high at a low income group countries. It remains number one at low middle income group countries. We fall under LMIC. It remains under middle income group countries, and it remains high in high income group countries. And why is that? Because only a limited number of population can afford the regenerative, rehabilitative dental treatment. That means that although technology has moved from foot engine to a rotor, I use foot engine to drill a cavity in patient's mouth. Now we have very advanced systems. We have implants, but affordability, accessibility, and the cost are too high for a common man to attain. And therefore, this global trend of oral diseases remaining at rank 1 is universal. And if you look at compared with other diseases, like oral diseases, the blue dot is the biggest. Chronic respiratory diseases is somewhere down, followed by diabetes, followed by cardiovascular, followed by mental. And if you see, all these dots are relatively smaller as compared to the blue dot, which is the biggest, which represents the oral health. The other thing which is very, very important for us to understand is that there is a life course approach required to manage the dental health. It is not that if you have an infection, you take some drugs and the infection is cured and you are cured. But that is not the case with the dental health or the oral health, because you need to have a continuous effort to maintain it to the level of hygiene and health. The caries in young children, that baby teeth, deciduous teeth, rises very high by 4 years, and it comes down because deciduous teeth shed down. As the permanent teeth erupt, as you can see with the red one, the red in this graph, the red line, the caries goes high, and then it might come down as you grow. But the issue is the periodontal disease, which is in purple, would affect with age. And by adulthood, you have severe periodontal disease, you lose the teeth, and edentulism increases. So therefore, to maintain a balance of health, it requires a life course approach. This is a situation of dental caries, little bit advanced, but I have chosen these pictures to make it very obvious. It is not the beginning of dental caries, it is the advanced stage of dental caries, which causes the loss of tooth substance. And once the tooth substance is lost, there is no way to repair it. The only way is to rehabilitate it with artificial material. Adults also suffer, like, for example, that was in kids. Young children, the ECC is increasing, and also it happens to adults and young adults. The consequence of dental caries are many, which can include osteomyelitis, dental abscesses, and all kind of infections, cellulitis, and sometimes Ludwig's angina. So therefore, the prevention of dental caries and early treatment is very much desirable. The gingivitis or gum diseases, they do occur, start from the puberty or even sometimes before puberty, which are usually associated with halitosis, gum recession, swelling of gum, bleeding, and eventually advanced periodontal disease, where you lose the teeth do migrate, and once that situation come, you are left with no option but to replace these lost teeth, with artificial dentures. So these consequences perhaps can be avoided. The efforts in developed countries where the DMF index was very high has come down. And why it has come down? Because they have taken huge efforts in education about the consumption of sugar, methods of oral hygiene, water fluoridation, and much more. In contrast, the periodontal disease, which remains #1 cause of tooth loss in our part of the world, which is Southeast Asia, has impacted not only the oral cavity, but also it has impact on systemic health, which we will have a little bit in brief now, and it will be in the second lecture. We will be talking in much more in detail. So periodontal disease remains #1 cause of tooth loss in our part of the country. And its association with systemic diseases will be discussed in the next meeting. But I have just shared this particular slide because this is a very, very important paper for as an introductory paper to understand that although the association is only with severe periodontal disease, where there is a pus formation, there is a lot of inflammation, not with the mild, but given the numbers of people with this disease, this association becomes very, very important, particularly in the cardiovascular risk factors. The third thing which we often encounter in the oral cavity is different kind of lesions in the mouth, which are white lesions, sometimes red lesions, sometimes migratory lesions in the mouth, and they can be sometimes the reflection of systemic disease. The most common in our population is leukoplakia, followed by submucous fibrosis. We have lichen planus in many patients, particularly women, postmenopausal, and some lesions are very difficult to differentiate clinically till you have taken the biopsy and done the histological examination. So the oral cancer in India is among, if you look at the top 5 most frequent cancer in male, oral cancer, lip and the oral cavity is #1, is ranked #1. So we are not only just the diabetes capital of the world, I think we are also the oral cancer capital of the world, particularly with reference to male sex. In female, the oral cancer falls on fourth category. This particular paper, which talks about cancer incidence estimates for 2022 and projected for 2025 from the National Cancer Registry Program in India, tells us that the mouth cancer is not going to slow down. The number of mouth cancer cases are going to be huge, and even with the best of services available to treat these cancers, the survival is at best 5 years. So therefore, we have to have a strategy to prevent the transformation of pre-cancer into malignant situations, because in almost 80% of the cases, the oral cancer is preceded by a precancerous lesion, and the dentist or the dental surgeon is the first person usually to encounter these lesions. And if he is able to warn, diagnose, and refer the patients, then you are able to reduce the mortality associated with due to oral cancer. And in many situations, reversal is also possible with nutrition and appropriate cessation of the habits, cessation of the cause, which includes alcohol, tobacco, and all forms of smoke. and malnutrition, periodontal disease. So all these factors together can, if taken early, can reverse. Among all particular type of lesions, I just wish to sensitize you that usually we think that white lesion is bad, but the conversion rate of red lesions, a proliferative verrucous leukoplakia, which is mostly reddish in color, is the highest. So if you see a lesion in the mouth which looks a little bit proliferative, you have to be more careful, and the chances of it becoming converted into frank cancer is very high. The Dr. Umesh also mentioned something about oral microbiota and its association with different type of systemic diseases. And now a lot of research is happening, and this is one of the most explored area around the world with respect to the cause of, I think you can note down this is a very important paper, with relation to many diseases. So how microbiota can affect immunobesity, diabetes, liver, pancreas, colon, and so many other things. Of course, oral diseases, it is related. So oral cancer. So the trend is now, because in many countries where there is no local reason for oral cancer, there is no other habit, they are trying to find that maybe it is oral microbiota, altered oral microbiota, which is causing this disease. National Academy has taken a very good step in creating a task force on oral cancer in India. And we did create a task force report, which is published in the National Annals of National Academy of Medical Sciences. It is downloadable. It is open online access, and it is published very lately, and it was released in 2022 in the presence of DG ICMR and Dr. Vinod Paul, and also other eminent people, including Dr. Sareen. The fourth condition where we are often asked to help is congenital birth defects of the face. And the most common one, particularly non-syndromic one, is cleft lip and palate. And the cleft lip and palate shows a wide variation in its presentation, from a small notch to UCLP to UCLA, BCLP, limited only to palate, cleft palate only, or bifid uvula, as you can see in the bottom line, and much more. And this particular variation, what you see here, unfortunately, the global burden of birth defects is high in poor countries. So according to March of Dimes, as you can see, India is somewhere little brown, less brown, and some other parts are brown. And Australia, you can see, is green with no least number of cases. I would also like you to refer to this very important paper, which talks about global, regional, and national prevalence, incidence, and disability adjusted life years for the oral conditions for 195 countries. This is one of the best paper I have read in this aspect. Although I'm not a community dentist or community person, however, with my added responsibility at AIIMS as a chief, I was pushing the agenda of National Oral Health Program with the government and with the WHO, and that is the time I developed immense interest in this area as a policy and to push the agenda of oral health for the country, and that made me read a lot of it. So you will have to excuse me if I do not use the correct jargon of word which is community dentists would like me to speak, but nevertheless I will convey the sense and the depth of it to the best. Now, looking at this paper, which talks about daily adjusted life years, it really gives us almost the same trend of diseases as I have given you one big chart. big flow. So the dental caries in baby teeth reduces with age. With the permanent teeth, it goes high and then it stabilizes. In periodontal disease, goes high with age, and after adulthood, it should slows down because you start losing the teeth, and then you have a tooth loss or dentulism. So we have to tackle all the problems at different ages. Now, I think this is another very important question for us to understand, because anything in this world now runs with economy. And economic aspects of oral health are as relevant to the country as any other aspect, because now the concern for diseases or the management of oral health condition is rising because they consume a lot of money from the government side. And therefore, the advanced dental treatments are mostly available in private sector, not in public sector. This is also an agenda which we have been pushing with the government, that we should have advanced centers like CDR in AIIMS, in other AIIMS, so that they could also provide advanced services to the people around the country. So if you look at the cost, then the oral conditions accounted for more health loss in terms of health loss than 35 out of 39 cancers. So oral health conditions are as expensive to manage as cancers. And the total health loss associated with oral condition was also comparable to those with hypertensive heart disease, schizophrenia, and maternal conditions combined. The indirect cost due to oral conditions worldwide amounted to US $144 billion every year, corresponding to economic loss within the range of 10 most frequent global causes of death. This is a very, very important statement. And the direct and indirect global economic impact of oral conditions may amount to more than US $442 billion. And these estimates will keep rising with increasing DALYs. So now, also, I am making this statement again, till now, the treatment of oral health conditions was not a part of universal health coverage. It has happened only very recently in 2024 in Bangkok Declaration, and we will talk about it. And in high-income countries, the dental treatment averages 5% of the total health expenditure and 20% of the out-of-pocket health expenditure. The reason that the insurance companies usually do not like to cover dentistry in their insurance plans. So only few procedures are covered in the insurance plan. If you look at the fact sheet about the universal health coverage, overall about the health, that almost 50% population does not have universal health coverage. Therefore, 100 million people globally are still pushed into poverty because they have to spend money from their pocket for the health reasons. So they are pushed from poverty into extreme poverty. And over 800 million people, which is about 12% of the world population, spend at least 10% of their budget to pay for health. When it comes to the expenditure on dental procedures, in India, we spend less than $1 per person, but where you will see that those, like for Australia, this is deep purple, it is about $50 to $300. So the ground reality is that oral health conditions are both the cause and consequence of poverty, because actions from the sectors like education, food, hygiene are not effectively enabled for the poor people. And most dental person like to only entertain people who have money in their pocket, and they do not like to spend any time in the public health system. And of course, there is sometimes inadequate outreach. So therefore, for any country to approach to manage the maniac of oral health diseases, which almost everyone is affected at some time or the other during the course of their life, the only way is that the bottom, as you can see, the self-care, prevention, and avoiding the risk factors, which means that you don't need too many specialists to handle you. If you look at the top of this pyramid, you need specialist care by dental specialists. Now, there are too many dental specialists, too many specialties and super specialties. That means only few people can afford and the costs are high. So there was an expert group created for oral healthcare services package, that what should be included in oral health services for the member countries. I was also a part of that group. That was on 1st of March 2023. Consequent to that, Bernard, who has been very actively pursuing this agenda from his side, they collaborated with the FDI, which is Federation d'Air International, which is a body which represents the dental association across the world. And they created 3 pillars, and they created objectives for 2030, that what should be the status of oral health of the member countries of the United Nations by 2030. So I'm not going to read all the detail, but the gist is that it starts with sensitization to the government, leading to some kind of creation of a package for affordable package for every citizen of the country. And by 2030, at least they should be able to get benefit out of it, and some response should come in terms of reduction of the prevalence of diseases. The World Health Organization has also been into the picture to support mobile technologies for oral health. For example, that there could be a system of using mobile phone not only to educate, but also to give primary treatment, emergency treatment, what we call it telemedicine these days. They have evolved the guidelines on these. And in India, for example, that there are people who do not have access to safe water, but they have access to a mobile phone. So this is a very, very strong and tool which should be used. And we had also done one nice paper on this, that what is the status of oral health in India sometimes back, I think few years back now. So what happened with that expert group for universal health coverage, which was created? They met in Bangkok in November 2024, and they did a landmark agreement by World Health Organization member states, that those who are signatory to WHO member states should prioritize the oral health. So now the oral health, since 2004, India is also a signatory to that, is a priority. So they are expecting a few commitments that the government should, or Ministry of Health of the Government of India is expected to commit how to reduce the oral disease burden, limit sugar intake, because sugar is a common etiology factor for obesity, NCDs, as well as oral. For example, high sweetened sugar saturated beverages, SSBs, have so high a sugar that and also their pH is acidic. So increasing tax on them, put them into the high tax category, or putting warning on all sugar products, promoting primary care through hygiene. And the other aspect is that now there is a lot of concern about dental amalgam. The India is also part of signatory to Minamata Convention, which means that we need to reduce the mercury in medical uses, and in dentistry we use in dental amalgam. So dental amalgam is being substituted with non-mercury based restorations, which includes composites and glass ionomers. So this is in very brief, but if you just Google it and write Bangkok Declaration, you will get the whole document, PDF documents. And whatsoever I have talked to you, most of this is also available at WHO website. And also You can just search it. So India started much before actually universal health coverage. I must compliment our visionary leaders. In the 12th plan, in 14-15, already the National Oral Health Program was launched. And the Center for Dental Education and Research at AIIMS was considered as the nodal agency to implement this program. Since this program, I took over in 2019, and we pushed this agenda very strongly, and we had several meetings of all the states, and now this program has not just CDR, but it also has centers like, for example, for cancer, we have Lady Harding. For pediatric and geriatric, we have at PGI Chandigarh. For developing modules for smoke cessation, it is at Maulana Azad Dental College, and also supporting dental treatment in different parts of the country by providing manpower and equipment. And the idea is that each primary health center should have a dentist available. In some states, it is already there, like Haryana and Punjab, but it is also effort to increase the level of participation by the people as well as by the persons who are posted there. So E-Dan Seva was eventually launched. It is an app and website which provides A to Z information about oral health, including how to find a doctor, which is the nearest doctor to you, how to reach him, facts, myths, self-analysis, symptom checker, and so on. So it is a very, very advanced software. It has many videos on oral health, and this is one of the examples of that video, which I'm sharing with you.
अब तो ब्रश कर लो भाई, शाम ढली तो तारे आए, ब्रश करने से दांत जगमगाए, ब्रश दिन में 2 बार, 2 मिनट हर बार, ब्रश दिन में 2 बार, 2 मिनट हर बार.
So this is one video, but there are many more videos. So if you try to log in at E-Dan Seva, you may not access this today, because I tried this morning and it was not working. Then I tried to find out, and I have been told that there have been some issue with the what they call it, something theft on the websites or something. So it is being sorted out. So soon it should be on. The other aspect is the oral cancer. So the Government of India, Ministry of Health has a screening of cancers. So the 3 cancers are included: CA breast, CA cervix, and the cancer of the oral cavity. So I was fortunate to help them in formulating the protocols for screening of oral cancers, in which we are screening all people about 30 years of age, to be done once in 5 years, and 3 cancers, as I mentioned before, along with hypertension and diabetes. So the age beneficiary is 30 to 65, and after it is screened, it can be referred to surgeon, dentist, ENT, and a whole protocol was made. So this protocol is available on the Ministry of Health, Government of India website. You can download the protocol of oral cancer screening. But essentially, we made a very simplified protocol, which required a very, very detailed but simple way to examine oral cavity. So a mask, a glove, and only wooden spatula. You could do it in sunlight, even torch may not be needed. And that was the cheapest way to examine oral cavity. Also, they were trained, people were trained, nurses were trained, and also we did how to self-examine the cancer and many more things. So with respect to oral cancer, it is not possible for me to cover everything now, but I would suggest that please go to the website. There is another aspect of government policy which is related to Rashtriya Bal Chikitsa Karyakram, RBSK. And in this RBSK mission, since when I was a joint chair for this program, I was able to request the government to include cleft lip and palate, dental caries, and hearing impairment also in the 4Ds. They are talking about 4Ds: defects of the birth, deficiencies, diseases, and the developmental delays. In the developmental delays, our concern was only with the speech and language, but major concern was dental caries and cleft lip and palate. With respect to cleft and lip and palate, this has been a very, very intensive program. And now, by default, any baby born with this deformity anywhere in the country is being identified and taken for treatment, at least for primary surgery, if not by the government, through NGOs. So rarely you will find a cleft unoperated. We used to see a lot of unoperated clefts at the age of 12, 14, 30, 50, even 80 years old persons. They never had the cleft operated. So the treatment of cleft requires multidisciplinary, interdisciplinary approach. However, all of them may not be getting that benefit of long-term interdisciplinary approach. However, they do get benefit of primary surgery. So we had created similar effort to educate people, and this website was created for the education of patients, which is IndiCleft, and also by for the research. Now, if you have so many different type of diseases, this is a picture from a composite picture with different diseases shown in one slide. What the spectrum of dental diseases could lead to, the complications can lead to. A young man with no tooth in the mouth, trauma leading to loss of incisors, crooked teeth or malocclusion, edentulous mouth, abscess, draining abscess, which is sometimes mistaken for tuberculosis. When I worked in Jhansi in 1980 as lecturer, actually, after I graduated from Lucknow. That was my first posting as faculty. And I used to get patients who were being treated for lymphadenopathy and draining sinus as a tuberculosis. And when I examined their mouth, I found there is a draining tooth. So if you just remove the infected tooth, the lymphadenopathy, and that will go out, the draining sinus will also heal. So similar, you really need to be part of the healthcare system. Panfacial fractures, as you can see there, tumors, and also syndromic patients. So we have different disciplines in dentistry, so many actually. So the one which, like you see in this, is a radiology, where the first patient comes to the oral medicine department, and after being examined by oral medicine, it goes to the radiology department. You have a very advanced techniques now, including 3D imaging and all kind of superimposition. And this 3D imaging has really made life very, very easy for the dental and oral surgeons and other aspect of healthcare as well, because now we can almost emulate or create a virtual picture of the skull, do all kind of diagnosis and planning. The pediatric dentistry discipline usually, and the infection control is very, very critical. Infection control is very critical in dentistry, because the dental office can be a source of infection or cross-infection, both. The pediatric dentistry, they often deal with children. They do their prevention, sugar control, restoration, and much more. And they want that their baby teeth should remain healthy like this. When they are born, they have, by 2 and 2.5 years, the first set of deciduous teeth is completed, and they should remain healthy. And also, when the permanent teeth erupt, they should erupt at the right place, and pediatric dentist usually helps to watch on them, keep an eye on them, and help them for the children to grow normal with respect to their occlusion and dental treatment. So we have the other branch called conservation of teeth, and conservation means that if you have a loss of tooth or cavity, that needs to be filled or restored. So beside restoration, now most and conservative dentists are doing a lot of endodontic procedures. Many of them are done under microscope. They can drain the infection through root canal, but I talked about extraction before, can be managed with draining, like you can see on the left side, on the top and the bottom, and that can resolve the infection, and then you can restore the teeth to normal, as you can see on the right side. So rehabilitation, infection control, manage of infection, and rehabilitation. So early childhood carie is a big problem, and that is also being managed by pediatric dentists. I like to mention here that these facilities are mostly available in public funded hospitals, as well as many advanced clinics to offer all advanced maneuvers of saving the teeth. The Department of Periodontics usually deals with the problems of gum and related diseases and the pathologies related to soft tissues in the mouth. The maxillofacial surgeons are treating not only the tumors and pathologies in the jaws, but trauma is also a big thing now. With the automobile growth in the country, the maxillofacial trauma has become a kind of a pandemic to manage. The on the right side picture, you will see the fluorosed mouth. Fluorosis has been rehabilitated by a prosthodontic specialist by giving crowns, and you can also make a full denture. The prosthodontists also, they replace the lost eyes and ear. So that discipline is called maxillofacial prosthesis, and very often they are now doing implant or dental implant for one tooth or multiple teeth. The discipline of orthodontics and dentofacial deformities is often looking at the faces which are abnormally growing face, like in this case, the upper jaw has grown more than lower. So you correct them with certain devices, which is called orthodontic treatment, and you get this kind of outcome. So this improves not only the function, but the psychological well-being of the patient. So a girl who is very depressed becomes extrovert, and that changes the life of a person. So like similarly in this case, pre and the post. And this adult patient who came to me, I think she came to me in 2004, and she was treated many places, but eventually anyway, we treated her, and she is happy and is still in touch with me. We maintained her smile and also prevented migration of teeth, because it was a periodontal migration happening because of trauma and periodontal disease both. So the extreme right is the smile, middle and the right. Sometimes we do get patients with the ankylosis, they need TNG ankylosis, they need to be treated for that through surgical removal, replacement, and this part is usually done by the oral surgeon, maxillofacial surgeon. We as an orthodontist would align their teeth like that, and this patient came to us because he had a very severe obstructive sleep apnea actually, and then distraction was planned for him. And then you see that how the very narrow nasopharyngeal passage 403, after distraction, mandible was brought forward, nasopharyngeal space has opened, and patient is able to breathe normally, and now he's married. He could not get married because he was a very high snorer, and of course, severe obstructive sleep apnea. So that's how he is now. We do a lot of volumetric analysis. And this was a software which was actually developed by our team with CSIO, and it holds a US patent, so that we know that which nasopharyngeal volume, which part is affected and how much it affected. And for the cleft patients like this with secondary deformities, we do orthodontics to give them a nice smile. So I have now last 3-4 slides, which are very interesting, and I hope I will need your full attention. I think you would know already that sharks will replace teeth usually every day, you know. So their teeth keep growing. And the rabbit's teeth could grow very long, because if he is not in the jungle, and if you are keeping him as a pet, you have to cut his teeth because he's not using his teeth the way he should use. So they don't grind away. So they start hurting him. But we are neither sharks, we are not rabbits. So what we need to do, we need to have a professional care to preserve and a personal effort to maintain them. So therefore, what has happened, so we have started using toothpaste, toothbrush, and similar devices, and it is good to use these devices. We also recommend that we should use it, but what it has caused another problem. because demand for toothpaste, particularly in Southeast Asia, is very high. But it says, if you read the first para, around 3.6 billion people, or half of the world's population, use toothpaste and buy about 20 billion tubes annually. So what does it mean? If you have so many paste and brushes, and the tubes, when they are discarded, what they do? So they create a havoc in this world. They are creating havoc in this world. So what we need to do, perhaps we also need to find a solution which is sustainable, alternate solutions to the packing of a toothpaste and the material which is easily destroyable, so that we don't spoil the environment. So another request: save Earth, save the planet. And if you want your baby to maintain healthy baby teeth, and if you want to have healthy permanent teeth, you have to do a lot of effort. This presentation which I have created is from multiple sources, from my experience working in AIIMS 40 years and working in overseas also as visiting professor to several universities. And I like to acknowledge the contribution which and help I received from my colleagues, National Oral Health Program, Ministry of Health, World Health Organization, the resources, publications, my team with which we worked with me for long, NAMS for giving me this opportunity, particularly President Dr. Behera. Dr. Sood is sitting left next to me, and he has been instrumental in organizing all this program. And of course, God to help me to do this. I would once again like to thank you for sustaining with me for that long. I know you are quite good in number. I was not expecting that big a number for a topic which is very dry. It's more of a community dental health, but I'm glad that many of you are here. Even Dr. Gopal Krishnan is here from Manipal, Dean of Manipal. And I'm sure many of his students must also be there, who must be listening. And many dental schools have actually put them into a classroom system that we may find there is only one link, but many more students are listening. I will encourage that the next lectures which are planned are very thoughtfully curated, and they are not just useful to a medical person, but also for a dental student. It's an altogether new perspective of dentistry, which we are promoting now, sensitizing the people. So please, if you could encourage and circulate this information to all your friends, colleagues, students, and also request them, they should also become members of the National Academy. National Academy does much more than this. Once again, I thank all of you for being here, and I'm happy to take any questions if there are.
Thank you very much, sir, for this wonderful session. Like you included all the videos for awareness, and then you also taught us, including daily, that is disability adjusted life years, and also the economic perspective. So since everything is linked to finances and economy once policy decisions are made. So thank you, sir, for simplifying the tough areas. I request the participants to write the questions or their queries or their doubts in the chat box. So it would be easier for us to pick the questions and compile them, and then we can have a discussion and we can learn in a further, in a better way. Thank you, sir. Sir, you mentioned one thing, and mainly in the end, that since with oral hygiene, a lot of brushes, toothpastes, they are coming, and majority of them, they are non-biodegradable. So, in the beginning of session itself, I had that question that you mentioned in the end. So, first, I would like to start from my side that now there is one concept that there are some brands which are coming with wooden brush with some I would say biodegradable. Uh, I would say those the wooden handle with biodegradable fibers. And then some people still advocate, mostly our elders that भैया नीम की एंड कीकर का दातुन कीजिए आपको वो बहुत फायदा देगा. So like with your scientific stature and with your expertise, sir, I would like you to guide all of us regarding the oral hygiene
Yeah.
and its
Yeah, there is a separate lecture on oral hygiene.
right, sir.
We intentionally kept it how to use oral hygiene products to the
Right,
best
sir.
of their efficacy. I think it is lecture is ninth lecture,
Right, sir.
ninth lecture. But I will briefly touch here.
Right, sir.
Actually, why we brush? We have to know this first. We brush to remove the plaque. And what is plaque? Plaque is a layer of mucin which sticks onto the dental surfaces. It sticks to the hard surfaces first. Then bacteria grow on it, then fungus come in it. So immature plaque becomes mature plaque.
Right.
And then mature plaques over the time gets all kind of bacteria, fungus, gram positive, gram negative, and anaerobic, aerobic both. And that leads to destruction of our gums and teeth, whatsoever. So now we have to remove this layer every day. The best way to remove this layer is mechanical because mucin is adherent to the teeth.
Right, sir.
Now, to remove that mechanical layer, we have to rub it. So how to rub this teeth? Rub with something. So the bristles, soft bristles, therefore are recommended to rub this. Other thing is that your bristles should reach to the remote area of your, because teeth has many surfaces. So the soft bristles can reach interdental spaces, occlusal surfaces and all that. Therefore, in my video which I have shown, इतना ही काफी है. मटर के दाने जितना paste ही काफी है, because paste is only a reminder for you to brush.
Right.
Paste is not the cleaning agent. Your cleaning agent is the bristles. And your maneuver, how beautifully you maneuver that brush to use in your mouth. So therefore, this training is important. And I can mention here that Ministry of Health Research in ICMR, in collaboration with ICMR, where I am involved in a project called Anant Muskan, we are trying to train the school children across India. We are developing a model so that the children, if they brush after the midday meal, at least once in a time, that mouth is plaque free. So if plaque is free to 0, once in 24 hours, that can work. So you don't have to brush twice, you can brush once. But you cannot always make plaque score 0 in one go. So therefore, 2 times brush is recommended. So all this will be discussed in the separate lecture. And I thoughtfully kept this lecture because when to use interdental brush, when to use water flosser. There are so many devices now available. How handicapped people can clean their mouth, how mentally retarded people can clean their mouth. So all these will come under devices, and we have kept it. I hope this satisfies your question.
Sure, sir. Sure, sir. Thank you, sir. Sir, there is one question put over YouTube that I can find. So Dr. Vijay, he asked that, sir, how the oral hygiene is impacting mental health of today's young generation. So that was the
I don't know about that, but there are some studies which recently have come up where the poor oral hygiene is being related with Alzheimer's.
Sorry.
So the concrete proofs are maybe coming soon, but some such work has come up very recently.
Right, sir. And Dr. Vijay, as sir mentioned in the lecture himself, that once there was correction, like in the appearance of dentures, and like once the smile and the gap was reduced, so the confidence that it boosts up and the mental health, it improves. That's sir mentioned in the lecture.
Yeah.
Yes, sir.
So sorry, I will interrupt here. There are 2 things. Hygiene is different, deformity is different.
Oh, you're right,
The
right, sir.
children who are affected with deformity,
Sir.
they are psychologically handicapped people.
Right, sir.
They are poor communicators. They are shy. They are introvert. And with my experience, I have treated children from so long that I am now treating next generation of them. They have become mothers and they are coming with their children.
Right,
That
sir.
how much psychological benefit they get it is difficult to perceive or think. It is immensely beneficial.
Right.
Yeah. So they feel that now they are normal. Otherwise, they think they are abnormal. Yeah.
Right. Right.
Yeah. It helps the mental health. Yeah.
Thank you, sir.
Yeah.
Sir, what I can see in the comment box that majority of the people, they are just praising about the session and they are just thanking you. So I couldn't see any question till now. So maybe the session was really very simplified, I would say, sir, that involving the social media things and involving the policy things and a lot of visual things were there. So it was indeed very interesting and everyone could follow it. So I still request the participants to, uh, yeah, your praises.
Dr. Gopal Krishnan is there. Will he like to speak
Yeah.
something? Any
Uh,
participants, I would like you to come forward and give their, please speak out. There's no issue.
Yeah, so if any participant is hesitant to type it, they can just ask us to unmute and we'll unmute them and they can ask the question. And yeah, Dr.
Oh, they can even comment, good or
Right.
bad.
Right.
I'm open to that.
all are good comments.
Okay. Yeah.
So, if anyone wants to ask, they can just unmute or they can just raise their hand and we can unmute them and they can ask questions. I've opened the list, sir, but I think it would be great if some of the participants, they can unmute and ask the questions. Sir, we were awaiting for the response, but I think the participants, I think
everybody wants an evening tea now. It is cold weather.
maybe. But sir, what in my personal opinion, that was such a simple thing, sir, and it was an introductory to the series. And thank you,
It
sir,
is
for
introduction to the series, yeah.
Right,
The
sir.
next lecture is by Dr. Gopal. He will be
Right, sir.
talking about the relationship between oral health and systemic health.
Right,
And he
sir.
will cover all those things, the relationship with particularly with diabetes, glycemic
Right, sir.
control, which
Right,
is
sir.
very, very critical with oral hygiene actually.
Right, sir.
And sometimes we have ourselves diagnosed many people looking at their mouth.
Right,
They
sir.
come to us and we say, did you get your sugar test? They said, no. I said, please get this. And we found that they are diabetic because the oral health becomes worse in diabetics. And the glycemic control becomes better when you improve the oral health. So there is a definite proven relationship on that. It is a bi-directional.
Right, sir. Thank you, sir. Still, we didn't get any questions. So, well, in my sir, personal, maybe small experience, but this lecture was really interesting and engaging, sir. So we could learn a lot. And thank you for initiating this series, sir. That this is very important series. So I think, sir, Sir Sood, sir, if there are no more questions, so we can proceed. So I would like to request Professor Ajay Kumar Sood, sir. Sir is the Deputy Secretary of National Academy of Medical Sciences for word of thanks. Over to you, sir.
Thank you. On behalf of the National Academy of Medical Sciences, it is indeed my great privilege and pleasure to thank the distinguished speaker for this session, Professor O.P. Kharbanda, sir. Sir has been our senior council member and also the emeritus professor, and he has kindly agreed to be the chief coordinator for this series on oral health, dental and oral health. So we are really grateful to you, sir, for your time. And as Dr. Jaswant said, it has been a very informative session for all of us. I am sure that all the participants, especially the faculty member from the different dental colleges, and especially the PG student, they must have got a overview of the global burden of oral health issues, and especially what the government efforts are in terms of oral health, national oral health program. Thank you so much, and we are really grateful to you for agreeing to be the chief coordinator for this series and also supporting the NAM for this. We look forward to your continuous blessings, sir. I also take this opportunity to thank all the faculty members from different dental institutions and the postgraduate students. And once again, I would like to say it is your own program. So please give us your suggestion. And some of the faculty members can even come forward to take session for this series on oral health and dental diseases. For the PG student particularly, those who are in dental colleges, I think this series is also useful for other postgraduate students who are working in a different specialty in the medical college. And the detail of this program brochure we have already shared with you on the chat box. Another information is that NAMS, in collaboration with the Indian Council of Medical Research, has started a online biostatistical helpline. So those PG students who are completing their thesis and they require some statistical support, expert from the National Academy and ICMR will be happy to help them. It is a free online registration and you can book your slot and consult the speaker. Second information is for those who are computer savvy. National Academy, in collaboration with the IIIT Hyderabad, has launched a 12 weeks program on artificial intelligence for health professionals. Currently, the third batch of student participant is going on, and the registration for the next batch is already open. And maybe some of you who are interested in artificial intelligence application in clinical specialties can register. And we have circulated this again on the chat box for your information. Otherwise, you can also refer to the website of National Academy of Medical Sciences for the details. As Sir said, that the next session is again going to be very interesting one. That is on third Friday. This session, we are going to cover a very interesting topic, how the periodontal diseases, they affect systematic diseases. This relationship is very important, especially he said about diabetes and hypertension. And then we have a distinguished speaker who is Dean Manipal College of Dental Sciences, Professor Gopal Krishnan Dharmaraja, sir. He has kindly agreed to take this session. And if you have any queries related to this topic, you can share with us and our expert will be happy to answer them. So once again, I would like to thank Dr. Jaswant for being with us and moderating this session so well. He has been supporting us from the very beginning and we are really grateful to you for your support to the Academy. Mr. Ravi, who is our IT officer in the Academy, along with Mr. Shivam, has been taking care that this session is broadcast on the YouTube as well as on the Zoom. And as our secretary sir said that all these sessions are available on NAMS website in the form of video. And the link is available on the website and we will also circulate you the details subsequently. And if you have missed some part, you can again look into the website and see the session as much as many time you like. Once again, I would like to thank you all. And on behalf of the Academy, I wish you all for the new year and best wishes for you and your family members. So once again, I would like to thank our distinguished speaker, sir, for being with us. And we are really grateful to you, sir. And we look forward for your continuous support and blessing. Thank you, sir. Thank you.
I'm very happy man today. In the beginning of the year, we are starting from mouth.
Yes, sir. Sir.
And mouth is such an important organ. It is, you realize its importance when you only suffer. You know? So therefore, it is better that we should not come to that stage of suffering. And I am really happy because the National Academy considered my proposal in this respect, number one. And number two, they allowed me freedom to choose the topics, which I chose thoughtfully. And also the eminent people from across the country, I thought who is the best person in this topic, and they agreed. So thank you to all, and we look forward to meeting you again on 6th January online. Yes. And those who are in Delhi, if they wish to come to NAMS office, they are welcome. Yes. They can come here. They can be part of this group. Yeah.
Thank you. Over to you, Dr. Jaswant.
Thank you, sir.
And thank you, Dr. Jaswant. You have done great moderation. I admire. I have tried to recollect you. When did I meet you? But now I will come and meet you in person sometimes.
Sir, I'll come to you, sir. I'll come to you.
Yeah, thank you.
Sir, thank you, sir. Still, a lot of compliments are pouring into the chat box instead of questions. So this was the questions with a lot of compliments and just few questions. So thank you, sir. For
why don't you share those comments with me? Those compliments are coming.
Sir, these are available in the chat box. I'll just take the screenshot and I'll.
That will make me more happy, you know.
Sure, sir. I'll send the screenshot, sir.
Yeah, I can see that. Abhishek Verma.
Yeah, yes.
Yeah, Chandran.
Dr. Rajshri Singh, Dr. Sampada Pradhan, Dr. Jay Chandran, Dr. Garima Chaudhary.
Yeah, there are
Yes,
plenty
sir.
of them. Yeah, yeah, yeah.
Sir, sir. So, and Dr. Manish, yeah. So, sir, it is really indeed, as Sud sir told, that it's a tough task that you know encouraged all the colleagues, all the eminent faculty for the series, and sir, organizing this series is indeed a difficult task, and we all thank you for this series and this lecture, and thank you very much, sir. And still, the praises are pouring in. Dr. Vijay Patil and Dr. Nishi Singh. Yeah. So, with your permission, sir, can we mark the closure of this session? Yeah. Thank you, sir. Thank you very much.
Thank
Sir.
you. Bye bye.
Bye, sir.